discussion. In recognition of Black Maternal Health Week, we're highlighting the importance of addressing the disparities Black women and birthing people face in maternal health care and why awareness and advocacy matters. Today, I'm joined by someone doing amazing, incredible work in the space. I'd love to start by having you introduce yourself. So, can you tell us who you are, the work you do, and what led you to become a doula?
I didn't hear the last part, but I'll try my best. My name is Theresa Lasbrey Peters. I'm a birth and postpartum doula and a certified, well, actually an international board certified lactation consultant. I am in private practice with my company, Nnenna Birth. I am also a community doula with Northern Manhattan Perinatal Partnership, with New York City's Citywide Doula Initiative, and with the Lower Hudson Valley Perinatal Network. I am also part of a number of Black Maternal Health collectives and initiatives. I'm an Earth app ambassador, and that is the app that is for Black and Brown birthing people to share and review the care that they've received in their various cities. So I'm an Earth app ambassador for a national ambassador, and I'm based in New York, based in the Bronx in New York. And I'm also part of the Postpartum Awareness Week Collective. And I'll share later about our Speak, Move, Change and our Awareness Week activities. We have something coming up that I'd love to share with you.
That is so much. And it's funny because when I first met you, your passion about what you do is one of the things that just came out really right away. Why did you decide to do this work? Why did you decide to become a doula?
I decided to become a doula because of my own journey with my own children. I had the same doula for each birth. I had glorious, pain-free, powerful, empowering births, and at some point started to help people with lactation and started to help people with planning their births and birth coaching and getting it together. And around pandemic, I saw that this was something that I wanted to give my life to. I wanted to make a difference, specifically for Black and Brown women and birthing people, to ensure that they could experience birth as a victory. There's a lot of talk about the Black maternal health crisis, how we are more likely to experience morbidity or mortality, where we're likely to experience adverse events or literally die in birth than any other, racial category in the United States. In New York, I think we are somewhere between 6 to 8 times more likely to die giving birth or to experience a really adverse outcome. Our cesarean rates are higher. But I am in this work to really address that it is not because we're, like there's something inherently wrong with being a Black person giving birth, but it has to do with the environment. It has to do with racism. It has to do with the things that get done to us that undermines our birthing experiences. And I'm here to counter that with information, resources, and anything that I can to help people not only survive. I don't want survival, I want them to thrive and experience the joy and the victory of having the babies the way that they want to have their babies, and knowing that this work impacts generations. The way you birth is the way you live. The way you live is the way you parent. The way you parent impacts generations for decades and it impacts generations ad infinitum, well into the future.
I'm listening to everything you're saying, and you think about those numbers that you said, and when you hear about the number, you don't really understand the graphs of how many people that is or what that looks like on a national level. But we do know, and the fact that we are having this week, we know that it needs to be a conversation about it because those numbers are way too high. And so you mentioned a little bit about a few of the challenges that you feel are the reason why those numbers are that way. But what are some of the biggest challenges Black mothers face before, during, and after childbirth, according to you?
I mean, so people are, there's a lot of talk in the medical world about Black moms or, Black birthing people coming in with more health issues, coming in weighing more or having diabetes already or having these predispositions, these comorbidities. But what I want to point out to even before we start talking about how that client or their patient shows up is to talk about how birthing happens in the United States. So in the United States, of all the so-called first world nations, in a group of eight, right, of the eight first world nations, so-called, um, we are the last when it comes to birth, right? This is the worst place to have a baby in a so-called first world nation. It is the unsafest place. The mortality is the highest. The morbidity is the highest. And this is not just for Black and brown women and birthing people. This is for everyone. And so that's something to really think about, right? White people giving birth, they are not in a good position to give birth. They do not have the best outcomes here. So then imagine if you are part of a marginalized group trying to navigate the same system. So our birthing practices are problematic. Our interventions, in my opinion, are out of control. Unnecessary, non-medically necessitated interventions wreak a lot of havoc. And so what I like to do is help people navigate, if I could get them preconception, navigate prenatally, preparing themselves for this birth, preparing their bodies, staying in action, moving, eating, wholesome, eating complete foods, looking at supplementation, providing these resources. Since I'm not a medical provider, I can give you information and then you can choose, what to do or what not to do based on your conversations with your own provider or just based on, what moves you, what you think you need. I'm really here to empower you. I'm not here to tell you what to do and how to go about it, but I'm here to give the information and provide the strategy and help you have the birth that you want.
And I think that that's so important because a lot of us don't understand or know exactly what the doula does, right? We see what we see on TV. It's, oh, you have the crystals and you have the candles, and you're telling us we don't need to go to the hospital. I mean, that's the way we see it sometimes. And so, if you could, I want actually if you could explain it in your own words, but I think you really did a good job just now saying, hey, I'm not a healthcare provider, but I'm here to support you in ways that I can. Can you give us a little more information on what a doula does?
So doulas are non-medical professionals that provide comfort and support during birth, before, during, and after birth. So when a doula is present in the room, people's experience of pain and discomfort during birth there are studies that have proven that that experience is reduced by 33%. So you can reduce that experience of pain by a third with the presence of a doula. Before the birth, I will provide you with information. Sometimes I provide, countdowns, timelines, suggestions, weekly reminders, um, information helping you prepare for postpartum, helping you navigate the tests and exams that you have to go through and how to respond accordingly. Like if you are end up with gestational diabetes, then helping you navigate your diet, and you will, your best served by talking to a dietitian, but I do help you with suggestions on the things that you can do, like, walk after every meal, add protein. We talk about the impact of vitamins on your fetal development and your just entire process. Vitamin D. You need a lot of vitamin D in pregnancy. Magnesium, you need magnesium in pregnancy. There are studies that indicate that the usage of vitamin D reduces adverse outcomes and issues by a great amount, right? Like, people don't think about these things, but what you put into your body when you're pregnant, what you put into your body before you have the baby, really makes a difference. And the little cheat code is that most of us will be able to fully provide nutrition for our babies that we're growing in our bodies. But if we do not supplement and take care of ourselves, the body will take that from you. The baby will be fine. The body always prioritizes the baby, but all the calcium to grow this human, to grow this little human inside of you comes from your bones, you
And
know?
that makes sense. It does. Like it's like where our bodies are, do this naturally. So it makes sense that it will make sure that the baby's okay. And it's like you hear the thing about, you can't fill others' cup without filling your own cup. But in this case, that cup's getting full. So if your cup is not full, you gotta do what you need to do to take care of it. So I definitely understand that. It
Yeah,
seems
definitely.
like it seems like the support piece is so crucial, especially in spaces where people don't always feel heard.
Mhm.
How, when you're talking to your clients, how do you encourage them to advocate for themselves in healthcare settings, especially
Mhm.
when there might be a gap in trust, especially when they
Mm.
feel like they aren't being heard? How do you, handle situations like that?
I think what's interesting is, like, one of the things that you mentioned about, like, people thinking about doulas and crystals and trying to not have you be in the hospital. We support you wherever you want to birth. So I support people in hospitals. I support people at home. I support people at birthing centers, all with um, medical provider present. I'm not a midwife. I don't help you. I don't catch babies, even though in my work I've almost caught babies. I'd rather not. Which is why I'm not a midwife. And we don't want to keep you from the hospital, but we have seen, right, that the longer you stay home, the easier your experience is at the hospital. The earlier you come to the hospital, the earlier you get these interventions, right? If you come to the hospital and you're early in the process, um, they want to do things. That's why they're there. They want to move it along, move you along, get this baby out, and that is their intent. Um, it's not personal, but it does have an impact on the quality of birth and the safety and maternal outcomes for everyone, especially Black women, Black people who are birthing at these hospitals. So one of the things that my expertise is that I'm an evidence-based doula. So a lot of people are out on the woo side, like, "Ooh, let's do these things." And then I find myself between the things that are not necessarily evidentiary, but anecdotal, which indigenous knowledge and ancestral knowledge is really important, and we should honor it and utilize it. And then I find myself between not ancestral knowledge, but just like woo made up things that aren't necessarily rooted in evidence or reality. And I'm then between that and hospitals that are extremely interventionist, right? They want to induce at 39 weeks because a study said that your likelihood of not getting a C-section is slightly improved if you do the induction at 39 weeks. But what is this study saying? The ARRIVE study, is it saying that you are likely to have a C-section if you induce at 39 weeks, or you're less likely to have a C-section if you induce at 39 weeks instead of 40 weeks, instead of 41 weeks, right? My recommendation is not to induce unless you absolutely need it, right? If you or your baby are in actual imminent danger that would require the delivery of the baby. That's preeclampsia, HELP syndrome, which is hemolysis, elevated liver enzymes, and low platelets, gestational hypertension, ACOG, the Academy of, I guess, of gynecologists or some such, does not recommend inducing for gestational diabetes. But there's this concern that because somebody has gestational diabetes, that the baby's going to be too big, and there's a concern that the shoulders will get stuck. There's a concern about shoulder dystocia, right? Which you have a better chance avoiding shoulder dystocia if you have a practitioner that has the tools and is prepared for it, and you're not giving birth on your back. The worst position to give birth in is on your back, unless, of course, your mind and your body tells you to do that. Right? Like if
Right.
you have this instinct to do that, then that's the position you give birth in. But to reduce tears, the best positions to give birth in are on hands and knees or on your side, right? Good positions to avoid shoulder dystocia, upright positions really help. And then just having a practitioner that is comfortable, not and knowledgeable and moves swiftly. Most midwives, many midwives are well versed in this. Like home birth midwives are well versed in all types of things. But the thing that I'm going back to is the interventions run rampant. And what I find is that, like, for instance, if you have a big baby, the evidence states that your greatest danger in having a big baby isn't necessarily the big baby. It's your provider anticipating that you're going to have a big baby. And the evidence is based on cases where people spontaneously had a big baby that they didn't think was going to be big, and the birthing process versus that sonogram that they do in your third trimester. They tell you the weight of the baby, and it's saying the baby's tracking over 8 pounds. This baby's going to be 9 pounds and up. And then they do all the things. They want to induce earlier because they're worried about the baby growing way too big for you to push them out, which people can push out 12-pound babies. Do we want to? No, thank you. But people can and have.
You already know my face over here. You already know how I'm looking.
They push out 12-pound babies sometimes without any tearing, right? They're worried about the size of the baby, but the thing that they're not necessarily being acknowledging is that late term, that third trimester sonogram is notoriously inaccurate. It is only correct 54% of the time. So a lot of times your providers give you this information like it's just a foregone conclusion. It's just the truth, right? When in reality, it's a supposition, and their approach to birth is managing it very closely in case something happens, rather than expectant management, which is being prepared to address whatever shows up, right? So there's stay ready so you don't have to get ready, or act like everything's happening right now, right?
Right.
And I prefer watching things, being attuned, and dealing with things as they come, as opposed to just this blanket approach to birth where you just in case we need this IV, just in case we're going to induce, just in case we're going to run a little pit. Oh, we're going to break your water. We're going to do these things that people do at birth. This is not a physiological birth. It's not a normal physiological birth to go through these processes. And what will often happen is they will do all the things, cause one of my favorite words that I learned in the past couple of years is iatrogenic, iatrogenic situations. And iatrogenic means complications caused by the hospital, right? These complications weren't caused because you were too big, or you didn't eat, you didn't work out enough, you didn't walk enough, you're too old. These are literally caused by those interventions. So thinking about it, right? an induction, you're getting Pitocin, you're getting synthetic oxytocin. Your uterus doesn't like it because it's too much. Your baby doesn't like it because they're responding, their heart rate keeps going up and down. So now you have to have a C-section. Would you have needed the C-section if you hadn't gone for this induction? Um, that might not have been necessary. Like if you have hypertension, if you have, preeclampsia, you need these interventions
Right.
to live. But if you
So,
don't have those conditions, maybe you can hold off.
right. And so as we come to a close, I have two questions left for you. And it's the one question that, of course, everybody wants to know. Like, what is one thing that we can do in the healthcare systems or in the community to fix this, right? And you've mentioned all of these amazing things already, but for us, it's always if there was one thing that you could change. If you had a magic wand, you feel like this could help the number go down. You feel like this will be the fix, and it could be either in the community or it can be in the healthcare field. That'll be the first part of the question. Then the second part is how do people support the work that you're doing? So we'll go to the first question first. So go ahead.
Okay. It's just, there's a lot of answers.
I know, and I'm like, maybe we got a little bit of
There,
time though. So
so, hmm, the main thing is that it's not just like what one thing you can do in the healthcare systems, right, to correct it, right? But I do think that in the training that, doctors, who are going into obstetrics get, they need to be trained to understand and be comfortable with physiological birth. They're very scared of a birth that they cannot control every aspect of it. They want IV, they want synthetic oxytocin, they want to break the waters, they want to um, twist the baby, they want to, help with the delivery, they want to stretch your, perineum, they want to do all these things. And if they would learn to let the body do what it does, we would have better outcomes. Learn to trust people's bodies. And then also, they have to address their own biases, right? Racism is real, implicit bias is real, and there's a belief in somewhere that it's very hard to get out of the medical world around this belief that Black people have higher pain tolerance or we have thicker skin. It's not true, you know? We uh we are human beings like everybody else. We experience pain.
right,
So trusting if obstetricians could trust physiological birth, right? I mean, I can tell you one thing for everyone. Insurance not being so like hospitals not being so caught up in billing, right? You do an induction, you do these things, you bill for all these things, and then you get a C-section, so you bill for that thing, right? By the way, obstetrics is not the most profitable part of a hospital, and often they're closing when these companies buy these hospitals, they close L&Ds all over the place to the point where, like in New York State, um, our attorney general has had to fight to keep hospitals, birthing centers open. But the concern of liability is so high. The insurance or liability, like liability insurance is so high. The litigious nature of birth is so problematic. But I think that birth requires a lot of litigation because there's a lot of intervention. So that's what the healthcare, you know, trust physiological birth, learn about physiological birth, learn how to deliver breech babies vaginally, learn all these things in addition to learning how to be a great surgeon. Understand that an obstetrician is somebody who deals with the pathology of birth, not necessarily the person who deals with a normal low risk birth. We need more midwives in the hospital. Midwives that are trained for physiological birth and who support that and support low to no intervention births. In addition to that, we need more education, right? As the people that are giving birth, really taking a prenatal birthing class, a prenatal lactation class is just really crucial and key to this process working for you so that you have the information, you understand your choices, and you can choose them powerfully. And most importantly, just knowing yourself, knowing what you want, and then working to get what you want and understanding how to speak up for yourself. And finally, get a doula. Get a doula, get a knowledgeable doula, and one that understands that this is your birth, not theirs, and supports you in having the birth that you want and provides you with all the information. Um, I mean, I'm sure there's like all types of things like legislation and this and that and that.
No,
And
that all that is the answers you've given is perfect. And I want to stop with the find a doula because or get a doula. Where do you feel like is the best way to find a doula? Where can we, if someone's interested in getting a doula, what is the first step on that process? Of course, we're going to share your information. Obviously,
oh
everyone's going to
yeah,
have your information, but how do people find doulas who may not be in the NYC, New York area?
I mean, there's like you can literally Google find a doula. You'll find probably doulamatch.net, doulamatch.net. You can ask people in your life if they've used a doula, right? And do they have any referrals for that doula? You can go online and look to see, follow a doula. You can look to work with a midwife who may recommend a doula. You may even have your own OB that might recommend a doula. You really have to do the research, but also try not to get overwhelmed. I think everything happens in its due time, in its divine time. And so people often feel like they're behind and all that other stuff, or usually the social media effect of everyone who's looking perfect before, during, and after their births, which is not reality. Everything's highly curated. Um, so I would say use the internet, use the directories that they have of doulas. There are Black doula directories. There's on Facebook, there are Black doula groups. And use your community and really search out for doulas. And if you're in the tri-state area, in New York, New Jersey, and Connecticut, come hit me up. I am Theresa Lasbrey Peters. You can find me at www.nnennabirth.com, and that's NNENNABIRTH.com. Send me an inquiry. Often I can help connect you to another doula if I'm not available. If you are somebody who is on Medicaid, there are Medicaid benefits for people to have doula care in New York City. You can also reach out to me because I also run the New York doula Medicaid doula collective. So we work on referring doulas to people who need doula coverage, reimbursed by Medicaid. Um, I think, just look around, ask around. I'm on Instagram at Nnenna Birth, Nnennabirth. PM me, send a message, ask questions, don't be afraid. Know that you can get a doula, and just, know your budget, and please prioritize the help of the person that you hire to be that wise person that helps you navigate your way through births. I stopped counting at like 150, but I've clocked about over 200 births by now in my many years of service. Like officially have been doing this maybe like um close to 6 years, but I've been doing birth work for over a decade.
Yeah,
So just look, and you can always reach out to me.
that's some
I
good
can direct you
information.
in a state.
Gotcha. Perfect. Well, Theresa, so much for sharing your knowledge and your work that you do with us today. This conversation is so important, and I'm grateful to have had it with you. I'm glad we were able to get this to have this conversation. And to everyone that's watching, take what you've learned, share it, talk about it, and find ways to support Black maternal health, not just this week because we have a week, but do this all year long. You may not be the person that's giving birth. You may have a sister or aunt or someone in your family or a friend group. Bring them to this video, get the same information, support them in that because it does take a community. So again, thank you so much, Teresa, for coming and talking to us today. And that's all we have. So thank you for joining us.
Wait, one more, well, but wait, there's more.
Oh, okay.
So I wanted to invite everyone to participate in, and I'll just if you don't mind me screen sharing, I'll share it with you. Go to the postpartum awareness week. Let me see if I can get this to work. Postpartum Awareness Week,
Okay.
we are doing the Freedom Train. Um, it's a wonderful immersive event that's taking place April 19th and the 21st. And then we have a 7-day virtual series from May 3rd to May 9th. And you can register. I'll share it right here. You can register at bit.ly/Freedom Train 2026. And so our work is creating uh, immersive experiences in honoring Black Maternal Health Week. We have an Afrofuturist movement dedicated to liberating Black and brown birthing people and their babies. And I think that you would enjoy it. So please come
This is
through.
this is the type of stuff, the information that we want to share. So thank you so much for sharing that with
Thank you for having me.
us.
Take care.